Good evening. We begin the programme with breaking news on the COVID pandemic. The first official analysis by UK government scientists has backed up studies showing people with the Omicron variant are significantly less likely to develop severe symptoms. But experts at the UK's Health Security Agency warn that high transmission rates could still lead to a significant number of people needing hospital treatment, and their early data also suggests any protection offered by a booster jab could wane within 10 weeks. The results of that study were published as a record number of daily coronavirus cases were confirmed in the UK, with nearly 119,789 new infections reported in the last 24 hours. Let's bring in our science correspondent, Thomas Moore. Good evening, Thomas. So good news on the severity of illness, less good on the rapid spread and the waning immunity.
Yeah, overall, I would say this was qualified good news, Mark. So if you look at some of the results that have come out from the UK Health Security Agency today, they show that people with Omicron are 30 to 45% less likely to go to A&E than those who had Delta, and 50 to 70% less likely to need to be admitted to hospital. So it fits with other research showing that Omicron is in fact causing mild disease, which is clearly good news. There are a couple of really important qualifiers, though. The first is that there were just 132 patients in this analysis, and also that they were by and large young, under the age of 40. And there weren't many over the age of 60. They're the ones who are much more likely to go to hospital. So the agency says there will need to be another round of number crunching in the weeks to come. I think the other really interesting data that came out from the agency today is on the booster, as you mentioned, and that shows that 10 weeks after you've had the jab, your protection against symptomatic infection drops by 15 to 25%. Now, they say that most people are between 8 to 10 weeks after the booster at the moment, so there's no immediate concern. And also they believe that protection against serious disease, the kind of stuff that would lead you to need hospital care, would hold up for longer. And at the moment, they say there's no need to rush into a decision to give a fourth jab, which is already the case in Israel.
Yeah, I was going to say the waning immunity issue looks important, but you're saying at the moment, I mean, Israel have gone for the fourth jab. Some other countries are now considering it. You're not hearing anything along those lines at the moment?
No, so the Joint Committee on Vaccination and Immunisation is keeping a very close eye on this, and there's every possibility that in future you will be in a situation where you would want to give a fourth jab, particularly if some of the modelling that's come out today from the University of Warwick and the London School of Hygiene, which shows that, you know, we could be seeing cases well into the spring. Well, if that does happen, then there will be significant numbers of people who may well be seeing a drop in their immunity, and you will be at that stage where you would be thinking once again to begin this round of booster immunisations that sweep through the population, but we're not there at the moment.
OK, Thomas, thank you very much indeed.